All right, we are here with Dr. Ali Navidi. He is a licensed clinical psychologist. He's also one of the founders of GI Psychology, which is local to the DC area, but also sees people all over the country. He is also one of the founders and past president of the Northern Virginia Society of Clinical Hypnosis. So, hypnosis is a big part of his practice. And he also gives a lot of talks, a lot about GI disorders, but also chronic pain, which is what we're going to dive into today, to universities, television, podcasts. So his work is featured all over the place. Ali, thank you so much for joining us.
Yeah, my pleasure. Happy to talk about pain because I think it's something that just needs more conversation around it.
Yeah.
Because I think there's tremendous misunderstandings around pain, and I think the stakes are very high when people misunderstand what pain is.
Yeah, and
Right?
it's complicated, it's tricky, and we want it to
Mhm.
be, very even as a healthcare provider, I want it to be very simple and straightforward. This
Right.
person has a rotator cuff tear on their MRI. That has to mean that there's
Right.
pain. So that it makes my life much easier if pain is this black and white A plus B equals C thing. But as you and I
hmm
have talked about so many times, it's just so much more complicated than that.
Well, right. And I don't think I've met yet a physical therapist that isn't totally down with that idea, right? They're working with pain so much that I think they see the different nuances, right? Because I think the general idea, especially I think with chronic pain, is often that pain equals damage,
Yep.
right? That's kind of like the fundamental barrier that we're working against,
Yep.
right?
Or to flip it, damage equals pain.
Yeah, yeah. And it's interesting when they do, like they do those MRI studies on population, right? And they see that, like just looking, for example, at like back stuff, that findings on the MRI don't don't correspond to pain, and then pain doesn't always correspond to findings,
Yep.
right?
Yep. So it's tricky. So let's just start with, because it's
Yeah,
complicated. So let's just start
yeah,
very broad, and also probably the hardest question to answer. But what is pain?
yeah. If we could like drill it down to like the most simplified idea, pain is a warning, right? It's and it can be a warning of damage. It could be a warning of that there will be damage if you keep doing what you're doing. And so, like, I remember I saw this demonstration, and when I saw it, I was like, "Oh, I love this," which was, to address the idea that pain equals damage. And it's so easy to do, right? Like, just take your fingers and then just start pulling them back like this till it hurts, and then stop. And so that pain that you felt doesn't mean that you damaged your fingers. It means your fingers after a certain point are sending that message saying, don't don't do this more because you might damage it if you continue doing what you're doing, right? Which is that idea that pain is a warning.
Oh, that's interesting. I haven't seen that demonstration before, but it totally makes sense, right?
Yeah.
The way I like to think about it is pain is your brain telling you something is wrong. Um,
Mm, yeah.
and your brain is telling you, oh, my fingers are going too far back. I better send this pain
Right.
signal that tells me something is wrong.
And I think we have to be careful of the word wrong
Yep.
because people might misinterpret. Because I know what you mean when you're saying wrong, but people might think wrong means like bad and damaged.
Well, that's where then, because I still think it's our brain telling us something is wrong, but does
Yeah.
that mean something actually is wrong or not?
Right. 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 So it's like something is wrong. Don't do this more
Yep.
because you've already done it more than I'm talking as my body,
Yeah.
and you've already done it more than I'd like you to,
Yep.
right? So please be aware of what's happening right now,
Yeah. And
right?
the pain is like one of the most important. sensations we can have because it tells us, hey, don't
Yeah.
keep doing that thing. If we didn't have
Yeah.
pain sensation, we put our hand on a hot burner and we burn our hand. So
Yeah.
pain, I think, is one of the most important sensations that we have. But from your point of view, where where does that, so if we establish that pain is our brain telling us something is wrong, or pain
Sure.
is our way, or is our brain's way of telling us something,
Like
where does that
warning
system,
something might bad might happen.
right,
Yeah.
so where
Yeah.
does that system then fall apart, or where can it go wrong?
Yeah. And I think there's a wonderful analogy with anxiety, right? Because anxiety and fear, I kind of put them in the same category together.
Yep.
Anxiety and fear are incredibly important, right? Like imagine if, for those of us who are parents, if you've got a kid that doesn't feel anxiety, that would make the parents feel tremendous anxiety, right? Anxiety is what keeps us alive. Anxiety is what keeps us from doing stupid things, or at least repeating stupid things, right? Like without anxiety, we're not going to last long in this world. So tremendously important. What is anxiety? Anxiety is also a warning. It's like, hey, if you just run across the street without looking both ways, you might not die, but you might, you know, like pay attention and be careful. This is a warning, right? So you've got these two ideas. These are both important functions in the body, important signals in the body, and they're both about warning us and keeping us from bad things happening. So if you look at anxiety, we get it wrong so much. Our brain gets anxious about things that aren't actually dangerous. And it does it a lot. Anyone with an anxiety problem will tell you that they're anxious about things that intellectually they know are not dangerous in any way, right? Like we've been into watching Seinfeld, you know, and he does his little bit about public speaking, where he says, they do a survey about people's fears, and public speaking actually shows up before death in terms of what people are afraid of. And so his joke is, like if you're at a funeral, most people would rather be in the coffin than up there giving the speech, right?
Yeah.
And obviously, like intellectually, we know it's better to be giving the speech, right? But our brain sees that as dangerous, and gives us most people probably anxiety to the level of, they're sweating, they're some people might even pass out. I mean, they're feeling that level of danger from just giving a talk to what is most likely friends and family,
Yep.
right?
So how does that
But
how does that then relate to pain?
yeah, so you see that this is like anxiety is one of our most important warning signals, and it gets wrong. It's wrong all the time. And unfortunately, it's the same case with pain. And so we can look at just the world of like back pain, right? And so when they do studies on can they find structural problems that are directly related to back pain? More often than not, they don't. So probably like 80% of the time, they might find a structural issue with the back, but it's not actually related to the pain,
Yep.
right? Because structural issues just naturally occur as we age.
Yep.
But frequently, the back pain is occurring because it's the warning signal gone wrong, right?
Yep.
And I'm sure in your work, that's a
Oh yeah,
very common thing.
we see it all the time, and so I think that's a good example of anxiety is a very normal and natural sensation, and
Yeah,
it's super beneficial. But then there are times where it actually doesn't serve, and it actually
yeah,
it actually holds us back. And I think what the other like the thing you said, like we can actually start sweating and like we can, get nauseous. Those are real
Yeah.
sensations. It doesn't mean they're made up.
Yes.
Right? Like that's a real
Yeah.
thing. So I think it's really important. Sometimes when we talk about this with patients, they get it. They think that like we're saying that it's all in your head and made up. It's not,
It's all in your head. Yeah.
right? Like so what do you say to, say to that? You can go too far and say all pain is in the head. So how do
Yeah.
you balance those two thoughts?
Yeah. Well, it's like, and that's kind of the joke. It's like, how do you not have pain in life? Well, if you don't have a brain, then you won't have pain. Because, like, you can't have pain without a brain.
Yep.
But the idea is that, you know, pain, this kind of pain is so common. They've come up with a special name for it. And actually, there's multiple names for it. One name is neuroplastic pain. And there's 100% no way that you can tell the difference between neuroplastic pain and structurally based pain, which some might be called like nociceptive pain or neurogenic pain, which would be the nerves. Just from the sensation, you cannot tell the difference, right? So it's not like if you're feeling this type of pain, you're going to know just from how that pain feels. And I know because I've had this is so common. I personally have had neuroplastic pain at least a few times where I've caught it, right? And maybe it makes sense to even just tell that story. I don't know.
Go for it. Yeah.
Yeah. So in college, I was into weightlifting, and I had a buddy who was into weightlifting and much crazier than me because he was on the rugby team. So everyone who plays rugby is kind of crazy. No offense to rugby people out there. So I was doing too much weight and I was doing it too hard, and I was like arching my back really weird, and there was like a pop, and it hurt, and I had done some damage, right? And then over time, like I couldn't move my neck, and then it got better, and it got better, and then I was fine. But after that point, maybe twice a year, maybe three times a year, something would happen that would kind of go out. And I would be, I'd have a few days of my neck would kind of be messed up. And that just went on for like 20 years, right? And I always believed that that was because I had just damaged my back, and that's just my lot in life, right? That a few times a year this was going to happen, and that was it. So then I went to this training about treating neuroplastic pain. It's called pain reprocessing therapy. It's a really, really nice treatment. So I'm driving, and I just got done doing Brazilian Jiu-Jitsu, and I started to feel that feeling in my back. And I was like, oh no, here it comes again. And then I was like, wait. And it was fresh on learning everything I had just learned about neuroplastic pain. And I was like, let me apply these treatment concepts that I just learned to what I'm feeling right now. And so as I'm doing that, it just faded away. And I was like, holy shit, this is real. And and then from that point, it started coming back a few more times over the next week. Every time I'd do the same thing, I would use the techniques, it would fade away, and then it just stopped coming back. And it hasn't come back for like 3 years now.
It's awesome.
And it used to reliably come back like at least three times a year, right? And the thing for people to understand is that is not unusual. Pretty much you can find neuroplastic pain in almost everyone, or at least they've had it in their past, right?
Yeah, and I think that's, I think that's a great story because oftentimes pain does happen because of something structural, right? Like,
Yes,
again, I want to emphasize as much as I can. We're not saying all pain is in your head. Like sometimes
right,
pain comes from an injury, and that's very normal. You strain a muscle, you herniate a disc.
right.
These are all real injuries. I think what we want to get across is, pain is very complicated, and it's not as simple as this structure is damaged. I have to have pain. So I think your story is perfect. There was damage
Yeah,
at one point,
yeah,
but that didn't necessarily mean that every single time you had pain after that, there was damage again, or that damage is still there.
Right. And I think the, and the advice is kind of like, okay, when pain becomes chronic, we want to start becoming a little more suspicious,
Yep.
right? We want to start thinking about it in a different way. Like when it's acute pain, like the body's going to tell us, right?
Yep.
There's going to be bruising, there's going to be limited range of motion, there's going to be a bunch of other things that you know a hell of a lot better than me,
Yep.
right? The body will tell us in different ways. But after that acute phase and things should have healed, but then there's still pain, that's when we need to start thinking about it a little differently.
Yep.
And it's fascinating because they've even done image like MR like brain imaging studies. They're showing like when pain is in the acute phase, it's showing up in one part of the brain, and then as pain shifts to more of a chronic pain, it actually shifts to more of the emotional centers of the brain,
Interesting.
right? Which is actually one of the targets when we're treating neuroplastic pain using PRT. We're treating their emotional reaction, because when they're seeing that sensation as danger, that's reinforcing the chronic pain cycle.
Yeah. Uh, I just had a person I was working with, and his previous experiences and his beliefs. When I first started working with him, he wouldn't bend forward. He hadn't bent forward for 35 years. I mean,
Wow. Yeah.
he told me he would never do it again. Um,
Wow.
and I said, well, what, why? And he said, well, because if I do that, my disc is going to explode out of my back, because he had a herniated disc before.
That's if you have that belief,
It,
that's a great reason not to lean forward,
right, because that
right?
would be damage, and shouldn't do that.
Yeah.
And so I said, great, like I totally understand that, like, and it was actually I cheated a little bit because he was a psychologist, so I actually used exposure therapy to, like, I actually used the words exposure therapy, and like we
Yeah.
got him to buy in there. But the point of it is, like, now he's gardening, he's shoveling, he's bending forward, he's tying his shoes, he's doing all of these things, and part of it was
Yeah.
getting him stronger, but also part of it was
Right.
just getting him confident that his disc wasn't going to explode out of his back the first time he did it. So we see it all the
Yeah.
time where someone has a previous injury, or we see it all the time where they have an MRI, and maybe it shows they have a labral tear in their hip or a labral tear in their shoulder,
Right.
and knowing that that labral tear is there then starts that cycle of thinking
Yeah.
about it, and then every time there's pain, you know there's the labral tear or there's the herniated disc, and it just
Right.
keeps that cycle going. And that labral tear and that disc are definitely there, but it's feeding off of the emotional response to how you feel about it in the first place.
Right. And that's the thing to understand is that and you just kind of gave a beautiful example, is when you're looking at chronic pain, often it's more about people's emotional reaction to that pain.
Yep.
And if you can just get people to feel safer and
Yep.
to feel more comfortable, often that chronic pain will slowly go away.
Yeah.
And you're in a great position to do that because you can help them to get exposed to those movements, right?
Yep.
As a psychologist, I can only work with their mind, right? But getting the mind and the body, getting them stronger, getting slowly moving a little bit more and more, is a wonderful way to expose them to that fear. Because what we know that when you're exposed to fear, it reduces,
Yeah.
right?
And so I think it's really important to address both. Like, it's not just in our heads, it's not just in our
Yeah.
body. Like, it's a pathway, right? So it goes from my hip to my head, back down to my hip, and it goes back and forth.
Mm-hmm.
And so addressing the mental side of things and the emotional side of things is really,
Yeah.
really key from your end. And then we also have to, like you said, get people stronger, get people moving better. So it's not, I think it's really important for people to understand, it's not either it's in my head or either it's in my body. It's always both. And then the question is,
Mm-hmm.
which way is it weighted towards? But for us, we think it's just important to always acknowledge that it's always both.
Right, right. Like I have an example of that. Also, it's like I was playing soccer a lot for many many years, and I at some point developed basically like chronic inflammation in my knee. And I tried this and I tried that. I don't think I went to PT, which I probably really should have, but um, but it just didn't go away, right? And eventually, I came upon this like stretching program, and it really helped, like stretching like my hamstrings, my lower back, and for whatever and my quads too. And for whatever reason, that was what did it for me. Whatever. Like, and again, this is probably more on your side, right? But that's what was needed, right? Because so there's things that you need to address the things that are going on in the body, and if you don't, you're not going to get the change. But sometimes when you address the things that are going on in the body, and then you still have that pain, you start to become suspicious. Okay, maybe there's also an aspect of neuroplastic pain.
Yep.
And the good news is it's not particularly hard to treat, especially when you're already working with a PT who can tell you, okay, we've addressed these structural things, and what I'm looking at structurally looks good now. And then there's still pain. That's the ideal situation to treat that neuroplastic pain at that point.
So that was actually going to be one of my questions is, how might someone who has pain, because we all have pain, how might someone
Yeah.
know whether their thoughts, their fears, or their beliefs are impacting their pain? Because I
Yeah.
don't want, I really don't want people to try to think, do I have structural pain or do I have neuroplastic pain? Because again,
Right.
the answer is yes to both. Like that,
Right.
that's how pain works. So I think the better question is how I'm thinking, or is my fear, or is my previous experience impacting my recovery or impacting my pain? So what are some ways people might know whether that's the case?
Yeah. I mean, like the easy answer is, you want to assume that there's structural stuff to address and get checked out, right? So whether that's working with the orthopedist or going to a PT who can do more of like a functional evaluation, you want to rule those things out. And then if you've still got stuff going on, then you can start looking. And like let me pull this up because there's some really good indicators that should. And again, this is no one of these indicators is like, okay, that means it's neuroplastic. But it's kind of like detective work. It's like, oh, you've got this piece of evidence. And as you collect more and more evidence, you become more and more confident that, like, okay, this is what we've got going on. So let me pull that up right here. Here we go. Yeah, so the first one is, and you see this, and I see this a lot in my line of work. If the pain is originating during a time of stress, right? I can't tell you how many people have come in with different types of chronic pain, and they're not putting them together. But when we start talking about history, they're like, "Oh yeah, my wife did tell me that she was going to leave me, or I just started this new job, or I started getting bullied at school, or da 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 da." Right? And I don't know if you've noticed similar patterns in your work as well.
Oh yeah, all the time. We always talk. I mean, there's plenty of research that shows high stress increases our perception of pain.
Yep.
It makes us more likely to be injured. But also, there's studies that show people under chronic stress, like when they make incisions in people's skin, people under high stress, the physical skin heals slower. So it
Mm,
affects the neuroplastic pain, the pain in our head, but it also
yeah.
affects our body's ability to heal as well.
Right. And that's a fascinating subject. It's like psychoneuroimmunology, like how the immune system responds.
Yep.
and we get into that because we work a lot with in like inflammatory bowel disease, which is an autoimmune disorder, and then there's actually research showing that clinical hypnosis can help the immune system recover faster from flares.
Interesting.
Right. So, yeah, yeah. Okay. So we know stress,
Yep.
right? That's a big indicator. Sometimes pain will originate without an injury or without a clear injury, and I've heard this so many times. I went to sleep and I woke up and my back was killing me, right? And people always will link it to something. They're like, oh, I think the day before I was sitting too much, or I was not sitting enough, or I did this new workout. And then you ask them, well, when you were doing the workout, did it hurt? And they're like, no. Did it hurt afterwards? Well, no. But I woke up and it hurt. That's another big clue.
Yeah,
And I
that's a
don't
big
know.
one that we see all the time is, someone's hip or shoulder will start hurting. There wasn't a clear injury. They get an MRI. It shows a tear. It shows degeneration, and then
Yeah.
it's hard for people to process that 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 image probably would have been the same a month before their pain even started. So the
Right.
image is important. Not that the image isn't important, but I think what's important is that the image doesn't have to look perfect to feel better.
Right. Right. Because we know if you do imaging on 100 people, let's say that are 35, right? Most of them will have some kind of finding,
Yep.
and most of them won't be in pain, or their pain won't actually correspond with the finding.
Yep.
Like they might have knee pain, but they've got a finding in their upper back or something like that,
Yep.
right?
So I think really, really important that if you have a herniated disc, if you have a tear, if you have something, that tear or herniated disc 90% of the time does not need to heal or go away to be out of pain.
Yeah, absolutely, absolutely. And then putting that together with these indicators that we're going through,
Yep.
right? Often you'll see symptoms that are inconsistent in a way that doesn't quite make sense, right? Like, this really bothers me in the morning, but not at night, or it bothers me at night, but not in the morning, or it bothers me when, I'm at work, but not at home, or, when I'm sitting in my car driving to work, it hurts, but when I'm sitting, doing something fun, like I don't, what I mean?
Yep.
Like, yeah,
Yep.
yeah, it
Yeah.
can be
So
very
if it's not
inconsistent.
consistent, and oftentimes we love to our brains, human brains, love to make connections. So we always like to say, well, it's
Yeah,
it's because I'm sitting in this position or because I'm sitting in that position. But more
right,
often than not, sitting in almost any position should be painful, or doing the
exactly.
same thing over and over again should be painful.
Yeah, yeah, and it's like I remember there was a woman who she would have pain when she bent over, but not when she was gardening,
Yeah.
and she loved gardening,
Yep.
right? Also, if there's like three or four also unrelated physical conditions. So, as an example, like they've got, pain, let's say in the chronic pain in their elbow, but they also have GI pain, chronic GI pain, or chronic headaches, or some other musculoskeletal pain. When you start accumulating a lot of those, just again, no one of these is like the thing, but each one should start to make you kind of like, okay, maybe this is neuroplastic.
Yep. What's one more on that list there?
Oh, like if you've got a symptom that seems to move, right? Like, okay, it's my lower back, but now it's also my upper back, and then maybe my shoulder. The body just doesn't work that way in terms of damage,
Yep.
right?
Yep.
Yeah, that's a common one.
Yeah, and I think one that we see that might not be like on that official list is what we
Yeah,
see is it's very common for someone to, if they're having pain, kind of hyper focus on the structural piece. So I'm having pain in my knee, so I know the cartilage is being worn down. or
Yeah.
I know that tear is getting worse, or I know that thing is getting pinched. And if
Yep.
what we find is if someone's thinking about that every time they have pain, that's a sign to us that there's again there's
Yeah.
probably a structural component, but there's at least some sort of mental emotional component because it's just affecting their fear and their ability to even move throughout their day without thinking about that structure.
Well, we describe that as these are two kind of mental components that are very common, and that is hypervigilance and catastrophizing.
Yep.
So, what is hypervigilance? It's a specific type of anxiety that basically involves scanning. You're always scanning and looking for trouble, right? Like, how's that knee feel? Like, I don't know, that's got a kind of a weird feeling. And then when you notice something, the catastrophizing comes in.
Yep.
And that's what you were just talking about, which is, oh, like I bet that cartilage is getting ready to snap, like it's wearing down day by day, and they've got this mental little picture probably of that cartilage
Yep.
just right.
Yep. Yeah, so
Um,
I think the ones you were talking about before, like the vague changing of pain, I think that's really common. What we see with what you were saying, like chronic pain, and then the
yeah,
hypervigilance. We see that a lot with more specific pain, but that specific pain can still be affected by how we think about it, and usually
oh
what
yeah,
we find is getting stronger, getting moving better is important, but also breaking that hurdle of how we think
hmm
about pain is also just as important.
yeah. That anxious scanning,
Yep.
right, linked to the catastrophizing,
Yep.
right.
Yep.
So it's like the guy with the discs that he was sure were going to burst, right?
Yep.
When he probably would lean a little bit, he was probably scanning very anxiously,
Yep.
and then he would feel something,
Yep.
and then he would be like, "Oh, that's the disc getting ready to pop,"
Exactly.
right?
Yep. That's
Yeah,
that's exactly. Or a shoulder, hip. It doesn't knee. The same process. Is just it happens over and over and over again.
yeah,
So what are you mentioned? Some things that you were doing for your neck. Like what's
yeah.
one thing someone can do right now to make an impact on their pain?
Yeah. So if they've got the good fortune of working with someone like yourself, and you're telling them, hey, you've got the green light, like structurally you're looking good, is just when they feel that pain to just remind themselves that they're safe. And they can do if they can do some things, not just at an intellectual level, but at a more emotional level, like whether they know how to do mindfulness meditation or some sort of breathing exercise, or to go out into nature and just enjoy the smells and the sights and the sounds, right? You're shifting your emotional responses from that, because anything you can do to combat that hypervigilant scanning and that catastrophizing is going to help is going to help,
Yeah.
right? So if you can remind yourself, oh yeah, Jesse told me that my knee and my leg are strong and I'm safe to walk around, right? And that you can remind yourself of that while you're like focusing on nature and the beautiful day, right? So you're interrupting that anxious scanning. That would be something people could do right now.
That's great. Yeah.
Yeah.
Sometimes like I had somebody who structurally everything was fine, but just a lot of neural pain, nerve pain. And
Yeah.
so I had her do exercises while she was listening to her favorite artist. Just like do the thing while you're doing something else you enjoy. Just like your patient that you were saying, you know,
Yeah.
gardening is clearly bending forward. Like that's there's there's very little that you have to bend forward more than gardening, but she wasn't
Right.
having any pain while she was gardening because she was actually enjoying what she was doing, and her mind wasn't doing the scanning. Is my back hurting? I
Yeah.
guess so. Doing something you enjoy is
hmm
awesome.
Yeah. And anyone can do it,
Yep.
right? We all have things we enjoy, and just if you can link those things together with some gentle kind of exposure
Yep.
to whatever that movement is, that's going a long way to help.
Yeah, that's great. So, what's one thing you wish everyone knew, or what message do you want to leave people with?
Well, I think I think the key thing and the message that I'd like to leave people with is um, that neuroplastic pain is extremely common and it's very treatable. And there's not like the old school is like shame around it, right? Like, oh, that's all in your head. Like, you're just hysterical, right? Like, this is like pretty much anyone you talk to is going to have neuroplastic pain, especially people with some kind of chronic pain. It's very common. It's very treatable. There's no shame in it. It's not just in your head. It's a mind body thing. And you don't have to live with it. You can, there are very clear things that you can do that someone like myself, who works a lot with pain, and someone like Jesse can do to help you, if you have that going on. So
Yeah, I think that's
don't just accept it as something like,
yeah.
oh, this is my life.
Yeah, I think like you said, you were just accepting that your neck was going to hurt 3 times a year for
Oh
20
yeah,
years, right? And now all
totally.
of a sudden you've been 3 years without pain. That's fantastic.
Yeah.
So I think I would go along the same lines. Like my message is, I like to tell people, instead of trying to figure out, is this a structural issue, or is this a mental emotional issue, or is it a lifestyle issue? Like, just accept that it's probably a little bit of everything, and be open
Yeah.
to, maybe you need to get stronger. Maybe you also need to work on the hypervigilance. Maybe, like, so just being
Right.
open to, it doesn't have to be A or B. It's probably a mixture.
Mm.
And usually the best form of getting out of pain is addressing all the different pieces that could be a part of it, instead of,
Yeah.
we find people a lot of time want to find the only single answer,
Right.
whereas often, like you said, it's great to work with both of us, or it's great to work with your surgeon and you, or your surgeon and me,
Yeah.
and just understand that pain is very, very complicated, and it doesn't have to be structural or not structural.
Right, right. I know we're running low on time, but I wanted to toss this in because you just reminded me of
Go
something.
for it.
Um, a while back, I started running, and I hadn't been running before because I hate running. But I started running for the cardio, and then after a while, my heel started hurting, and I was like, oh no. And I talked to a friend of mine who's really into running, and he listened to me and what was going on, and he was just like, oh, you're just too weak. And I was like, oh, like I love that answer because then I just started doing strengthening stuff, and the pain went away.
Yeah.
And the thing is, the pain probably went away because of two things happening, not just one. One is getting stronger, but two is me having confidence in my friend that what I was doing was going to help.
Yeah. I mean, that's
And so I stopped the hypervigilant scanning and the catastrophizing because I knew I was doing the right thing by strengthening.
Yeah, there's a
And it
there's
was
a
gone.
huge piece into just feeling okay with it, or having an answer, or having a direction. There's a huge
Yeah.
piece to it. That's great.
Yeah. Yeah.
All right, Ali, if people are interested in learning more or want to contact you, how can people find you?
Yeah. Um, Go to gipsychology.com. I know the name is GI like stomach, but we work with all kinds of chronic pain, and that's the place to go. And we've got a free phone consult that people can do, and they can ask a lot of questions and figure out if that kind of treatment is right for them.
Great, that's awesome. Ali, this has been great. Thank you so much for your time.
Yeah, my pleasure, Jesse.
Good
Thank
good
you.
luck with running.